Ina. I am the CEO and founder of Red Dog Blue Cat. My passion is to help pet parents discover the amazing power of fresh food that I discovered myself with my own pets, and to help them figure out how to keep their pets healthier and living a better quality of life longer.
My name is Sarah, and I am the nutritional consultant for Red Dog Blue Cat. And one of my main jobs here is to educate pet parents and help them to learn how to feed their pets and take care of their pets using as many preventative tools as they can. We talk a lot about food, but we also like to help people understand how they can assess their pets at home so that they can figure out what the best route is and make really fast, appropriate decisions for their pets.
When we get a pet in our life, they rely on us to make decisions for them. And they can't communicate with us, they can't use words, so the only tool they have to communicate with us is their bodies. So today we're going to talk about how to assess our pets, and so that we know what their normal looks like, so that when something does go wrong, we can better understand it and catch it earlier.
Because they can't talk, you have to have ways for them to be able to tell you how they're feeling. And if you're watching and you're listening, then you really can assess that for them, and through their behavior, through how they're holding their bodies, and actually feeling them over, and just being really aware of what normal looks like for your pet versus when something might be off. Even when something goes a little bit off, if you know where normal is, you can get on top of things a lot faster and prevent something from kind of snowballing. So that's always our goal.
Assessing your pet isn't about putting them through a medical exam. It's about utilizing the time you're spending them normally when you're petting them, when you're hanging out with them, and just being a little bit more focused and intentional about what you're checking out on a daily basis and kind of how things feel and how things look. So it can actually be quite also a really good bonding experience, because you're really, the nice thing about both dogs and cats is they love to be touched. So make it an enjoyable experience. Don't make this I must do this every day at 5 o'clock. Pick a time when you're both relaxed and really use it as a way to build your relationship with your pet, while at the same time really learning about them. When something does go wrong, when we take our pet to the vet, they only see your pet in that moment. So they really are assessing with the information that they have at hand, and without knowing what the normal looks like, there's often a risk of them misdiagnosing or going in a completely wrong direction. So in order for you to be able to intelligently interpret what your vet is telling you, and if you've got a really good vet, they might give you some options. And if you know your pet well, you might be able to better identify what it is which option is the right one. But if you don't know, they're really a lot of the information they're getting is a very small sample of an entire data set. So by learning what your pet's normal is, you can actually be better equipped for those vet visits, and being more into, being able to give feedback to the vet if they're on the wrong track. Weight is a really important indicator in health. And so one of the questions that we often get from people is, how do you know if my pet is an ideal weight? Because that's kind of how do you tell what ideal weight really means without putting them on the scale or even putting them on the scale?
There's a really easy way to tell if visually and by feeling your pet whether or not they either are a healthy weight, which is basically their ideal weight, if they're underweight or they're overweight. So there's a bit of a body scoring system that you can use where it's out of 5, and 1 would be very skinny, 5 would be very heavy, and then 3 would be kind of their ideal situation. In order to assess where your pet fits on that scale, you would want to be checking their ribs, their spine, and their hip bones, and you just want to be able to feel them but not see them. If you can see them, then they're probably underweight, either a stage 1 or stage 2. If you can feel them but you can't see them, that would be stage 3. If you can't really feel them without kind of sticking your fingers in, but you can get to them, then they're probably stage 4. And then if you really can't feel them or see them, then they're probably getting to the more, getting to stage 5, which would be more of an obese dog or cat. And then you would kind of assess their diet plan from there and probably their exercise plan as well.
Now the other thing you can also look at is their waistline. So you want to see a nice tuck by their waist.
Someone's a little tiny bit stage 4.
Because as they get a little bit chubbier, their waistline kind of starts lining up with their chest. So you really want to be watching for a nice tuck right here as a healthy indicator of good weight. So what about using a scale for weight? Is there a time when you do need to use a scale?
Yeah, the most important time to use a scale, obviously, like if you ever have to take your pet into the veterinary office, they'll always just ask you to put them on the scale. It's good to take note of what that actually says at the time. Make a note of visually what they look like at that weight so that you can use that as part of your assessment for how much they should weigh or they need to lose or gain weight. If you have their exact number, that's how your veterinarian can help to assess exactly how much medication they need to be prescribing, what the dosage would be, and then you can also use that information for supplement serving sizes and things like that. So it's a good idea to weigh your pet, you know, even if you could do it every 6 months or every 3 months would be great. Every month would be amazing. If you have a smaller dog, you can get on the scale, weigh yourself, then get off, then pick up your pet and stand on the scale and then obviously do the math. If you have a larger dog like Alfie, who you might have seen in some of our videos here, he's quite large. I think he weighs probably close to 180 pounds, so it's not very easy to do that with them, so you would have to have a full-on stand-on scale for them.
So it's really important to check your pet's skin and coat, because how the health of the skin and coat on the outside is really a mirror and a manifestation of what's happening on the inside. So often when there's some kind of illness happening on the inside or an imbalance, the first place you're going to start seeing that in the skin and coat. So when you're looking at the coat, you want to check to see, is it, how does the coat feel? Is it soft? Is it oily? Is it really coarse? Does it feel brittle and dry? In a healthy dog, the coat should be pretty soft, especially, Alfie here, he's got some coarse areas, but generally he feels very fluffy. And I don't get a really oily film or anything on my hands when I pet him. If you're not sure, have somebody else who's not as familiar with your pet check them, because we often get very accustomed to how our pet feels. So this is one of the places where having somebody outside your home even kind of give it a feel and a smell can help you get a bit of feedback, because normally a healthy coat shouldn't have much of an odor. Even the wet dog smell isn't really very prominent unless the dog's coat is not very healthy to begin with.
How does Alfie smell?
Alfie, come here. Alfie smells like shampoo because he just had a bit of a bath and a brush, but he always smells very, very nice. And again, because if you know what your dog's skin normally feels like imagine after giving a bath, it kind of feels nice and fluffy. It should really feel that way all the time. And what can happen when a pet's not healthy is their skin gets really oily and greasy, and it starts feeling quite grungy, and that's not a normal thing. That means that there's things coming out of the pores that are getting onto the fur that indicate some lack of health on the inside. Now, the skin is considered to be one of the biggest organs in our body. It really does manifest a lot of what's going on in the inside. You really want to make sure that your pet's skin is very healthy and doesn't have any irritation or any soreness, because if you see any of that, it could indicate a health issue internally that something's going on.
So, let's talk about poo.
Oh, my favorite subject.
So why is it so important to look at your dog's poo?
Well, you know what? It's one of those where what goes in must come out, and what comes out has gone through the entire intestinal tract and really gives you a bit of an insight into what that digestive process looks like. For example, before I switched my dog to raw, before I switched to Dara to raw, her poops were massive and they were stinky, and everybody's like, that's normal because that's what you see for pets. And everybody that talked to me about raw told me their poops are going to get smaller and they're going to get less stinky. And I'm like, okay. And when I switched her, it was true. And now that you think about it, it really does make sense, because when your poop is what comes out that's indigestible, and you do need some indigestible fiber in the diet for your gut flora, but not an excessive amount. And the other thing that comes out is filler, which is also indigestible. So if the majority of the food that you consume is coming out the other end, the question is what's left. So with fresh food, we're digesting a good proportion of it, which means the stool should be pretty small and pretty dehydrated and compact. The other thing is that the stool should actually look like the color of the food. Dogs are fed raw. One of the things that people are surprised about is that the poop changes color every day, because you're feeding a variety every day, which is perfect. That's what you want to see, because you want that variety and you want that live kind of a change. It's better for their gut flora, and it's better for nutrition in general. Now, the other thing that most people don't realize is that poop actually has another function, and that is to stimulate the anal glands for dogs. So in nature, dogs and cats would eat bones and other things and fibers, not just because they need it for digestion, but to also make the poop bumpy, so it stimulates the glands and helps them release. So what we're looking for is not uniform poops. Poops that are actually kind of chunky and have a weird shape to them, because that actually helps massage the intestinal tract and stimulate the anal glands. And that's the most natural way for them to poop and make sure that everything's working properly. Sarah, you got anything else on poop? I know it's one of your favorite subjects.
I love seeing So I really am sort of obsessed with checking my pet's poo. And so when I'm walking Rowan or checking the cat litter, I'm always looking at what color it is, what size it is, what shape it is, and kind of what the consistency is. Sometimes there will be ones that are kind of stinkier than others, maybe less formed, and sometimes that will correlate with maybe them not feeling so well. So I always use it as kind of a daily barometer for how my pet is feeling. So that's one of the best ways to check. It's one of our most important tools that we have, that we can just use every day to evaluate what's going on, because it's an external look at what's going on inside their gut.
One thing that when dogs eat bones, sometimes you will see poop that's kind of yellow and very dry. And what it means is that when your dog is eating bones, they're getting extra calcium. And unlike synthetic calcium, natural calcium will come out through feces at the end of the meal. So it's not something to panic about. All it means is they got a little bit of extra calcium and their body is naturally getting it out. So if it's yellow and kind of crumbly and very firm, that's okay. You don't want that every day, because that does become hard on the digestive tract process, but once in a while it's not a bad thing, it's not unhealthy. Just like with every other body function, get to know your dog's normal. If their poop is normally softer, then that's their normal, and you've got to be aware of that and kind of see if you can help them a bit, but also not panic and go, okay, this is really bad. If their poop is normally solid and then it becomes soft, then that's a time to start asking questions. Why has it changed? What's changed about them? Is it stress? It's not always food related. Sometimes it can be stress. It can be just, a change in their environment, or it could be a change in diet.
Yeah, so this is a really important one, and it's something that, if you have a rescue dog, or you have a dog that you adopted when it was older, or a cat that can not like to have their mouths looked at so much, it's really important to approach checking the mouth in a very gentle way, a very non-aggressive way, so that you can actually get a good peek in there. And sometimes, it starts with just handling the mouth and not even looking at the mouth. So if you have a dog from a young age where you've been able to do that, I always encourage puppy and kitten owners to get their pets used to having their mouths handled. So that's the first thing, is if they're not okay with having their mouths handled, that's the first step. And then once you can take a look in there. It's good to do it on a fairly regular basis so that you can assess whether or not they maybe need a dental cleaning, if there's a lot of plaque going on in there, if there's any inflammation on the gums. Also checking their actual teeth, make sure there's no breakage or change of color in their teeth. And then also obviously checking their smell of their breath is another big part of it, because if they have really stinky breath, then that might be a sign either that something's going on with their oral health or something with their GI health as well. So Rowan is a great example because she actually has a broken tooth. So I have to check her teeth pretty regularly because at some point we might have to either remove it or have a replacement done or have some work done on it. Good girl. So you can see she has a very big chip in her canine there. But I'm just very gentle about how I approach it so that if she is having a spaz about it, then I just bring myself down a little bit so that she's not reacting to it. So that's how you would check the front teeth. And then you can also check in the side as well. I don't know if you can see that, but she has a little bit of brown staining, but no tartar and no redness of her gums. And I actually am able to get in there and use a dental tool on her. She does surprisingly let me do that. So if you can handle their mouths, the more you can handle them, the more you can kind of help them along at home. If you are really struggling with it and you can't really get in there and take a look, but you can smell that something's not right, or you can visually see a little bit that something's not right, then obviously the best idea is to take them into your veterinarian, either have them sedated or under general anesthesia to have a look in there and see what's going on. So that's kind of you do as much as you can at home, but sometimes it requires your veterinarian's assistance.
Bones are a really great way to keep their mouths healthy because it helps them naturally scrape the tartar off their teeth and exercise their jaws and massage their gums. So it does contribute in a significant way to dental health. So if your pet likes to chew bones, then that's a really great way to, on a weekly basis, help them maintain better health of their mouths.
Eye health is something that you have to stay on top of, because if you do see anything, even if it's a small thing, it's really worth just taking them in to get it checked out if you see any changes with the eyes. So it's always a good idea to be watching that on a daily basis. I personally had a dog, he had cancer, and the first thing that I ever noticed before I ever knew he had cancer was that he had kind of a clouding, like a blue clouding in his eye, and I didn't know why that was, but I did take note of it and then realized later on that was part of his kind of degenerative process that was going on. So not to say that it's always cancer, but their eyes are very indicative of a lot of things going on in the rest of the body. So there's even a science called iridology, which is these people that specialize in looking in the eyes to assess what's happening in the rest of the body. So the best thing you can do from your point of view as a pet parent is just to make sure the eyes are really clear. If you know that your dog has brown eyes and there's no noticeable spots in them anywhere, and you know that that's normal for your pet, if you start to see a spot in the eye, or you see a change in the color of the eye, like a clouding or a blue shade to the eye, or if they have a lot of redness and swelling around the outside of the eye, if they're blinking a lot, that could be an indication that they have injured their eye, if they don't want to open it, or if it seems really swollen. I also often like to check the eyes thoroughly after they've been bombing around in the bushes, because sometimes they can kind of scratch themselves on things, and as long as you stay on top of the checking, generally you can avoid any long-term issues. If you miss something like a scratch on the eye and it becomes infected and etc., then that can lead to more difficult outcomes. So you definitely want to be checking as often as you possibly can.
For daily check, you're not doing shining lights or opening their eyes. It's wait until your pet is relaxed, you're cuddling with them, and then just intentionally look and make sure that and if you do that every day, then you'll get a gauge of what their normal is and what their eyes normally look like. So it'll be easier to pick up that, that's what you're...
Yeah, and generally you want to see clear, shiny, that their pupils are able to dilate and contract properly, that they're the same size on both sides, and they're not having any visual issues. Sometimes behavior can change if they have visual changes. So that's another really key thing to watch out for in senior dogs. Sometimes you may startle them because they don't see you coming up to them, or so that would be another indicator that you would generally see in an older dog. They're starting to lose their eyesight as well.
And one of the things he said earlier was that when you see skin issues, especially irritation, the next thing you should check is the ears, is because there's likely going to be other issues there. So what do you mean by that? What do you check in the ears?
Well, ears it's kind of nice because I actually use my phone and I'll just turn on my flashlight and I'll take a little look down inside the ear as much as I can. If they need to have a deeper look into their ear, if you can't see anything visually going on, then your veterinarian can do that. But as far as just general daily checking of the ears, you would want to make sure that they smell fine, that they're not yeasty, they don't have any kind of like stinky odor to them. That would be the first step, that maybe something isn't quite right. A lot of discharge from the ear is also another sign that something might be going on, either parasite or some kind of inflammation in the ear. If they're really uncomfortable, if they have some sort of ear infection going on, or they have something actually lodged inside the ear, sometimes they will flatten their ear, or they will even shake their head a lot or hold their ears kind of weird angles, or even maybe get a little bit of a head tilt if it's something really out of sorts. So that would be a good indication to check the ears. If they're scratching their ears a lot, if you see a lot of redness and inflammation in the ears, those are all indicators that something, probably time to go see the vet. And then I always check the dog's ears again if they're running around in the field or they're running around in the bushes. They can get things lodged inside their ears, so it's good to check and see if you can see anything in there that you might have to remove. If you don't feel like you can remove it safely, time to go to the vet again. If you see a lot of inflammation or chronic ear infections, things like that, that would be more of a overall more chronic condition, like an allergy type of situation, or like atopic dermatitis. Those types of dogs can often have chronic ear infections as well, and that can often be an indicator that there is a need to support their gut and their skin health.
Sarah, one of the things that I hear about very often that makes me super sad is when people when their dogs have ear infections and they take their dog to the vet gives them antibiotics or something to treat the infection, but really doesn't get to the bottom of what the underlying cause of that ear infection is. And so it helps reduce the infection, but then a month later, the infection is back. And so you see these dogs that are in this chronic, sad cycle where they're constantly getting ear infections, yeastiness, smelliness, and they're constantly uncomfortable. So one of the things that I've learned over time is that the underlying issue is really not the ears, it's the gut health, it's the digestive health, and usually it's an indication that their microflora is imbalanced, and that's allowing that yeast overgrowth to happen. So in some ways, just like the skin, the ears are an indication of internal health and gut health. And if you don't treat the gut health and you just keep treating the skin infection or the ear infection, you're going to go through this vicious cycle where your pets are constantly going to be getting the same issue over and over and over again, and just getting doses of antibiotics, which actually will make it worse because now you're destroying the little gut flora that they have. So this is one of those scenarios where vets often don't know what to do with it. They treat the symptoms, but they don't really look deep inside what's going on. So one of the things that we really emphasize is when you see these symptoms, don't just jump to treating and disguising the symptom. You don't want to suppress it. What you want to do is understand what's causing it. So the goal of fresh diets, of supplements, of probiotics, of what we teach is about healing the inside, so that which then manifests outside, and not suppressing the symptoms on the outside. One of the things that I find is really important is when you're going on walks with your dog, watch how they move. I mean, you've talked about motion before and watching how they're walking and how their muscles are working. So, I often see pet parents, and I've been guilty of that myself, on their phone, getting distracted. But when you're on a walk with your dog, it's the best time to gauge their normal. What speed are they walking at? How does their gait look? Are they limping? Do they look uncomfortable, or do they look relaxed? Can they run? And just getting a general sense of their rhythm of motion, because all of those are really great indications of how healthy their musculoskeletal system is and everything else. And so if you know what their normal looks like, what are they smelling? Are they eating grass? Are they eating dirt? So for some pets, that's a normal habit, right? They'll eat a little bit of grass when they're walking around just because it tastes good to them. Grass that's one of the questions we get a lot is it okay that my pet is eating grass? Well, it depends. If it's a normal thing for them and they do that on every walk, then probably yes. If it's something that they're all of a sudden starting to do and the change in behavior, you want to understand why that behavior changed. But to do that, figure out what their normal looks like and watch them when they're walking. Watch how they move, watch when they stop, watch what they're sniffing, and get to know what their normal walk looks like, and what their normal run looks like, and what their normal swim looks like, whatever they're in, because that will give you a really good baseline of where they're at health-wise, so that if they start limping, or they start feeling uncomfortable, or they slow down, we see that a lot with older dogs, that tells you that something's not the same anymore. And then you start looking at what could that be, and you can try different things to see if it'll improve to do, you kind of become a bit of an investigator at that point of maybe some joint supplements will help, and see if it changes back to normal. Maybe some gut health support will help. Understanding your pet and monitoring them is a lot about trial and error. There is no perfect answer, because our pets are individuals, and their issues are going to be very individual to them and will manifest in different ways. So the better we know who they are and how they normally act, the better we can then do that trial and error ourselves before rushing to the vet and getting a Band-Aid solution. Thanks for hanging out with us, and I hope you had just as much fun as we did. One of the things I realized when I started teaching people about raw is it was just the beginning, and there was so much to learn about our pets, nutrition, health. I'm looking forward to continuing that learning journey, and thanks, Sarah, for hanging out with me on that, and I hope you do too.
It's very fun, and we're going to do lots more videos soon.